contraceptive pills. Contraceptive pills, but also, you guys, we won't say pills because there's pills. It's just the delivery form. There's pills, there's patches, there's rings, okay? So all of these, there's implantables. So you have to then categorize it by what is in this method that you're using. So when we talk about hormonal and we talk about estrogen and progesterone, that is the most reliable because those are the ones that are in your body, okay, that you have during pregnancy. And truly what we're doing is we're mimicking pregnancy. So remember, here's ovulation, here's estrogen, remember that? And then here's progesterone. Remember that? Right, you guys? So if you get pregnant, remember these go up, right? So what we're trying to do is to fake your body out so that you don't ovulate, and instead of this coming down like this, we're going to make it like this the entire time. So we're going to give you pill or patch or ring you get a dose all the time. And then at the end, we simply withdraw. You have a tiny period here because you didn't have these huge changes. Remember, the progesterone is what thickens your endometrium. Remember that, you guys, in the luteal phase? If you don't get this big dose of progesterone up here, and you get this solid line right here, you don't get a thickened lining of the uterus. This is how we control bleeding. And this is why we use pills if people have heavy periods. Then you withdraw here, and then you start your pills over again here on day 1. You go without them for a week, you have placebo pills, and then we start over. Is that clear for everybody? So this is why estrogen and progesterone combined are the most effective form of birth control. Now, you can never, ever, ever let someone take estrogen without progesterone if they have a uterus. Okay? If they have a uterus. They cannot have unopposed estrogen. Meaning, the opposition to estrogen is progesterone. So if I put an estrogen patch on myself right now, I have a uterus, it's going to make my lining of my uterus continue to grow, and then that can cause me to have endometrial cancer. So anyone with a uterus, if they're on hormone, they can have estrogen with progesterone, or they can have progesterone only. But they can never, ever, ever have estrogen only. Okay? So estrogen, progesterone, most reliable pills, vaginal ring, patch. It mimics pregnancy and prevents ovulation. However, what do we know about estrogen? What does it do to your blood? It thickens it, yes, and you're at more risk for a clot. So you have to teach patients aches. This is clot risk, okay? This is clot risk. So you teach them to call if they have abdominal pain, chest pain. Okay, so this could be a clot to the abdomen. Chest pain could be a what? PE, right? Headache, that could be a what? A stroke. Eye problems, that could be a stroke. And then severe leg pain, which is a what? DVT. So anybody who is on estrogen and progesterone combined, you have to do this aches teaching. You have to do this aches teaching. Oh.